నమస్తే, వెల్కమ్ టు అవర్ ఛానల్. నేను అంకిత. ఐవీఎఫ్ ట్రీట్మెంట్ తీసుకుంటున్నారు చాలా మంది. అయితే ఐవీఎఫ్ ట్రీట్మెంట్ తీసుకుంటున్నప్పుడు అసలు ఎలాంటి టెస్టులు చేపించుకోవాలి? ఎలాంటి జాగ్రత్తలు తీసుకోవాలి? సో, ఐవీఎఫ్ ద్వారా పుట్టిన పిల్లలు ఎలా ఉండబోతారు అనే విషయం చాలా మందికి చాలా డౌట్స్ ఉంటాయి. సో, ఈ డౌట్స్ అన్నిటికి క్లారిటీ ఇయ్యడానికి నాతో పాటు ఫెర్టీ9 ఫెర్టిలిటీ సెంటర్ కుకట్పల్లి బ్రాంచ్ నుంచి డాక్టర్ ప్రాచి కుల్కర్ణి ఉన్నారు. మేడంని అడిగి మరిన్ని విషయాలు తెలుసుకుందాం. హాయ్ మ్యామ్.
హలో.
మ్యామ్, అయితే ఇప్పుడు చూస్తే నౌడేస్ చాలా మంది పిల్లలు లేక ఐవీఎఫ్ ట్రీట్మెంట్‌కి ఎక్కువగా ప్రిఫర్ చేస్తున్నారు. సో, బేసికల్లీ ఫస్ట్ వాట్ ఈస్ ఐవీఎఫ్?
So IVF full form is in vitro fertilization.
ఓకే.
In vitro means outside the body. So the patients who are not able to conceive naturally or with treatments like IUI, those patients we suggest to go for this IVF treatment. So what we do in IVF is uh, it's a treatment which is divided into first part where we give medicines along with injections to stimulate the ovaries to develop the eggs. After the eggs develop, around 10 to 12 days it takes. After that, we take the eggs outside the body by a procedure called ovum pickup procedure or oocyte retrieval procedure, which is done under anesthesia. Once the eggs are outside the body, in the lab, in the embryology lab, each egg we inject it with a sperm of the husband of the patient. So this procedure is called ICSI, intracytoplasmic sperm injection. So now we have combined the egg and the sperm outside the body in the lab. So next day embryos should start forming. So that is called fertilization. Once the egg is fertilized, it is called embryo. That means the baby has started developing. So these fertilized eggs are then kept in the incubator at ideal temperature with good culture media, so that these embryos will develop slowly, and by day 5 or day 6 they become blastocysts. So these blastocysts are the embryos which we put back now again into the uterus of the patient. So till the egg development procedure, injections are given, eggs are taken out, embryos are formed and cultured in the lab for 5 days. After that, now the embryos are transferred back to the uterus of the patient. So once that embryo is transferred back, after 15 days, we do a blood test called beta HCG, where we know the success of our IVF. So this is what an IVF cycle is. So these patients who require IVF are those who have problems with their fallopian tubes. If the fallopian tubes are blocked, or if they are surgically removed for some reason like hydrosalpinx or for ectopic pregnancy, or if the tubes are damaged because of endometriosis or some infections like PID where pyosalpinx or hematosalpinx has happened. So basically damaged fallopian tubes, or even for the patients who have undergone a sterilization procedure, which is a tubectomy procedure.
ఓకే.
So those patients can directly go for IVF if their tubes are not functioning. Because when tubes are not functioning, then egg and sperm cannot meet in the body. So this is the first indication. Other indications are like multiple IUIs have been failed, or for patients who have male patients who have azoospermia, where we have to take out the sperms from the testes because the sperms are not present in the semen. So those patients who have zero sperm count, for those patients also we can take out the sperms from the testes and then we can use it for IVF. So these are some common indications for IVF.
ఓకే. ఈజ్ ఐవీఎఫ్ పెయిన్‌ఫుల్?
Okay, so IVF procedure, as we saw just now, that it is divided into injections, then egg pickup procedure and embryo transfer procedure. So these three things are the main. So pain is like something which is subjective, but still what I can say is it is not painful, because the injections what we use in IVF are hormonal injections. They are given in units, which is like a very small amount of the volume of the injection. So it is like how diabetic patients take insulin daily. So the same way we use these injections, mostly subcutaneous, means just under the layer of the skin, and these are given most of them on stomach or on the buttocks. So when we are giving in subcutaneous, the needle is very small and short, Even the injections which are given intramuscular, like tetanus toxoid, or any other vaccines which are given intramuscular, like in the muscle on your hand or buttocks, will be more painful because that needle has to go deeper. But these needles are small and it is just below the layer of your skin. So these injections are not that painful. It is like how diabetic patients take insulin. So this is about the injections of IVF. So this is not painful. The pickup procedure, egg pickup procedure or oocyte retrieval procedure is also done under the guidance of vaginal ultrasound. And there is a needle which goes next to the probe so that we aspirate the eggs out. So because this needle is going, we do this procedure under anesthesia. So usually patient will not come to know anything during this egg pickup procedure. After the egg pickup procedure also, there is no severe pain, and we give prescribe painkiller medicines for 2 days or 3 days. And that also, the pain is not very severe. It might be just lower abdominal heaviness or little bit of discomfort for initial 2-3 days. So even the egg pickup procedure is not painful. Embryo transfer procedure is done without anesthesia because it is not painful at all. It is like how you have a speculum examination in a gynec consultation. We just put in the speculum, we clean the vagina, and with a catheter which is made up of silicone, which is, you can compare it to a refill or refill of a pen, which is very narrow and small and without any needle. So we take the embryo with this embryo transfer catheter inside the uterus. So even embryo transfer procedure is not painful at all. So this IVF is actually not painful. If you talk to the patients who have already undergone an IVF procedure, you will come to know that the pain which is associated with injection is minimal. Egg pickup is under anesthesia. Embryo transfer doesn't require anesthesia.
Okay. During in this process, patient how to take care?
Okay, during IVF procedure, what a patient should do to have a smooth or without complications procedure. So what patient is supposed to do is maintain the hydration. Take adequate fluid intake in the form of water, coconut water. If you don't have any diabetes or any other issues, you can opt for going for juices also, but reduce your sugar intake. Maintain your hydration properly. Take high protein diet. So high protein diet means preferably vegetarian proteins, which will include many different pulses, dals, or even the sprouts which are boiled. You can have curd, paneer. In non-vegetarian proteins, you can have egg white daily. You can take protein powder during this time. So maintain your hydration, have high protein diet, also have many colorful fruits and vegetables in the raw form or salad form, so that you get many antioxidants and vitamins. So all these will help in the egg and sperm quality. So this is what we advise about the diet. Regarding the medications, please consult your doctor properly, understand the medications. So the medications are in, we can divide it into two: injections and the adjuvant medicines. So injections are usually given in the clinic. It's clinic's responsibility, and they have to give the proper dosage. They have to maintain the cold chain properly for the action of the injection to come properly. So that is one thing the clinic will take care. What you have to do is follow the correct timing of the injection, which is very important, because the action of these hormones will not last more than 24 hours. So preferably try to take these injections around the same time every day, so that the action will be maintained and you will have a good response to these injections, which will reflect in the number of eggs we retrieve. So maintain the timing of the injections properly. Then coming to the oral medication part. So oral medicines are usually vitamin tablets and antioxidant tablets, like folic acid, vitamin C, vitamin E, vitamin D, coenzyme Q10. So all these medicines usually also help in your egg quality. Sometimes if we are giving coenzyme Q10 to the husband, then it will help in the sperm quality. So all these medications you have to take properly. So this is about the medications. Third thing is your mental health. So mental health, what you should do is Try and do some pranayam daily, so which will help you. These are the breathing exercises which will help in maintaining the oxygen levels in the body, which will help you in relaxing. Listen to some good calming music, or practice some of your hobbies where you will not have this undue stress of your ongoing IVF cycle, or talk to some your friend or your husband regarding whatever emotional things you are facing. Talk to the counselor, talk to the doctor if you have any doubts. So when you have a good, peaceful and positive attitude, then definitely it will help you in the IVF procedure also, and the success also. So this is about diet, diet, medications, um, and the mental health issue. So now about the exercise. So usually the patients who are already doing exercise, what we advise is they can continue doing low intensity workouts, but once your injections like on day 5, day 6 onwards, the follicles become bigger, so the ovaries become heavier. So then exercise in the gym or dancing and all will not be possible for few days. So you discuss with your doctor, but definitely you can go for walks, or at least 20 minutes to 30 minutes in a day. Walking daily also will help you in maintaining your weight and reducing the stress levels. So this is about the exercise, and this is about how to take care during the IVF process.
Thank you so much, ma'am.